Cura Personalis is caring for the entire person, mind, body, and soul. By being aware and honest of the uniqueness of our own strengths and struggles, we are better able to understand our connectedness to one another. This allows us to live and serve with love, integrity, and compassion.
I would definitely say Cura Personalis has been a part of my nursing practice. And I specifically remember a event that happened my first med-surg clinical. I know med-surg clinical, the first time, you're really focused on your, head to toe, you want to do everything right. But I remember a specific instance. I was given a patient who had undergone a traumatic accident, and she was in her final hours. And I remember the only other person in the room was her partner. And so the focus was definitely less, like life supportive measures and definitely more emotional support. So I remember just being in the room and listening to all the stories her partner told about like the happy times they shared together. And at like some point I was like, holding her hand. And really grateful to have shared in that moment with them. And I think that kind of embodies what Cura Personalis is, which is like care, for the whole person, And I think that's an example of, what it means to be a woman for and with others.
There's so much more to each person, not just the physical. There's the mental, the emotional, the spiritual, and the family aspect. And in my first clinical, my very first patient in clinical, she was there for observation. She didn't have a huge medical workup. And her biggest concern was being able to send a text message with a picture attached to it. And so was that something clinical that I needed to help her with? No. Was it something I could do? Absolutely. And she was so excited. I taught her how to do it. I did it and then taught her how to do it so that she could attempt to do it later. And then also this past summer, I was fortunate to participate in the chaplain mentorship program. And during that experience, I witnessed a burn victim receive her last rites. And it really was a privilege to be a part of that spiritual care for both the patient and really her family and provide that closure.
I would say that my interest in nursing really stemmed from my passion of holistic care. I really believe that nursing should encompass caring for the patient as a whole and not only focusing on like the physical aspects of it or the diagnostic aspects of it, rather than looking at the patient as different parts, not only the physical, emotional, but the spiritual being as well. I really think that the phrase Cura Personalis means exactly that, and that is caring for the person as a whole. I definitely want to use that mentality and that belief in my own nursing care. I definitely believe that it is important to understand the science behind what we're doing, but I also think that in order to provide care that is empathetic, care that in all encompasses who we are as Loyola nursing students, is following the belief of Cura Personalis, which is caring for the whole person.
Cura Personalis means so much to me. To care for the whole person is something that I want to embody in my nursing practice. Not only does caring for the whole person help our patients feel better, but it also makes them feel seen and understood and heard, and all of those are really important to help our patients have better health outcomes. So I always want to make sure that in my nursing practice I'm remembering something super important, and that's Cura Personalis.
Something that I've tried to do in the past couple semesters that I've been in clinicals is talk to my patients just like any other person. Sometimes they're not comfortable with you to just walk in and say, hey, like, I'm going to put my hands on you and do this clinical assessment. So thinking about them as a whole person and thinking of yourself as a whole person, I think really helps with that connection and helps you be able to take care of them in a meaningful way and in a comfortable way. I have things that I offer from my personality and thinking about myself as a whole person in my nursing role, not just as a clinical provider, but as someone who has spiritual needs and has hobbies outside of school. my patient has those things too. They're not just their clinical needs. And I think it really improves my care and improves their stay if I can just talk with them and get to know them. What's their family like? What are they left behind at home? What was their career like? What's important to them? Just makes a huge difference in my comfort level with them. I think it makes me better at taking care of them, and it makes their care experience better. And I never would have thought about it that way if I hadn't been at Loyola. And now I'm just looking forward to taking that everywhere I go.
For me, Cura Personalis means taking care of the person mind, heart, body, and soul. This is especially important during situations such as these, where you as the nurse may be your patient's main support system during their hospitalization. So taking a few extra moments to speak and get to know them may make their day a whole lot better. I've used Cura Personalis during my clinicals by getting to know my patients and helping them in situations, as well as running small errands for them, such as getting a phone charger or their favorite drink from the vending machine. So, as nurses, we are taught to holistically care for our patients, and I hope that you all can implement Cura Personalis in your future care as nurses.